about life. Let's have a little conversation. Let's talk about life. Let's learn a little information. Let's talk about life. And let's talk about life.
Good morning. This is Velva Lee Heraty, broadcasting from beautiful St. Petersburg, Florida. It's just a gorgeous, gorgeous April day. I'm very excited about the show today. I feel like everything we've been doing on addictions, Dr. Jim Lewis and myself, has led up to this particular show. And I think this is probably going to be the introduction of a much, much larger subject and how much he and I can spend researching this, which I think is a very underreported, misunderstood, and complicated issue. It's the senior who is in fact an alcoholic and presents with other symptoms that are misdiagnosed. This is chronic. The more I've looked into it, the more Jim has looked into it, the more we find out it is progressive, chronic, and completely under the radar. And I think our job today is, I'm hoping, we're planning it, so we both have a lot on our plate, but this, I think, I'm hoping to be the introduction of a series on the alcoholic senior that flies under the radar, what Jim has labeled, we called it the senior addiction in disguise, because it's presenting as dementia, as Alzheimer's, as strokes. The list is endless. So we're going to open the door to this. And by the way, this is the first show in a long time that I posted on Facebook that got immediate responses and stories. Stories about relatives, stories about sisters, stories about people significant to other people that are have completely abused drugs, alcohol, and primarily, by the way, medication. And this is where it's going to get really sticky because I have to start picking the brains of some shrinks I know and just try to understand exactly how damaging, which I'm guessing is very, very damaging, but more importantly, for the caretakers of these folks, how undertreated it is and how the caretaker, who by now is crazed, trying to figure out how to help their senior person they love, grandma, mom, grandfather, whomever, and haven't a clue because they've been misdiagnosed. And that's a horrifying thought. It's just a horrifying thought. So we're going to start opening that door, and I expect to get some pushback, but you know what? I love pushback because it motivates me to research more and to learn more. So come on, pushback. I'm here. So that's my aggressive introduction to today's show. I want to thank Joe and over at my friend over at I'm getting rattled now because I'm getting excited about the topic at UPS at 2nd and 2nd South, the premier UPS store for all of St. Pete. By the way, I think it's important for you to know that Joe is now open on Sundays, so they're open every day of the week with full services, and you name it, and they've got it. So passports, mailboxes, packaging, gift cards, you name it, copying services, faxing, whatever. So, and they're very friendly and they're very customer conscious. So go over to 2nd UPS and get all those needs met. Don't wait, okay? Because, y'all run at the last minute and the next thing you know, you're paying more for your deliveries. Don't do that. Plan your life. Isn't that easy to say? Okay, so thank you, UPS on 2nd and 2nd. Jim, of course, by now, if you've been listening to the show, Jim Lewis, Dr. Jim Lewis, is a neuropsychologist who is, I'm finding, very high profile because I talked to somebody that knows Jim and thinks the world of him and didn't know that I knew him. And I happen to talk about the show, and it's a councilwoman, Wendy. Yeah, okay. So he's absolutely amazing. So I'm not going to go into politics, but the point is there's people out there that need and use Jim's service every day. He works for the Pinellas County as a diagnostician and treatment provider and every other thing. So here we are. We're looking at alcoholism with seniors. We're looking at pill swapping. We're looking at those crazy seniors who suddenly have all the time in the world, and the responsibilities are over. The last kid's out of the house, and a lot of them get this, hey, let's party attitude. I've been holding back. One man said to me, I've been holding back all these years, like, the big sacrifice, right? You raised a family, that should be enough for you. But it wasn't. So as I planned this show and talked to Jim about it, and we really got excited about it, I started going back to some of my clients back in Chicago. And I had a practice for almost 30 years, and it focused around alcoholic family systems and substance abuse. And over the years, it morphed into my Jungian dream analysis as I got training in that. The training took almost 7 years. But I think of the early clients and how entitled they still felt about drinking, using, self-medicating, even in their senior years. It was like they didn't learn anything growing up. And then I started thinking about state-dependent learning and all these different theories that started coming forward for me. State-dependent learning is something that when you're working with alcoholic teens and young people, you understand that they can't learn at school if they start their school day getting high because they don't learn. They literally don't learn. It's been researched and proven. So these kids, once they get clean, and some of them do, they basically have no education because they've been stoned every time they weren't sitting in class. So I thought about that, and then I thought about the seniors. Well, what if that was true throughout the developmental phases? What if all these, party guys and party girls, half the time they're supposed to be at work, they're taking a joint at their break, they're drinking at work, they're self-medicating, popping a pill for their nerves, and all of this stuff. Well, how much are they learning? Is state-dependent learning, my question, and I don't know yet, is state-dependent learning dependent? Is that only applied to teens? I don't think so. I think if you're mood altering and changing the chemistry in your body, it doesn't matter if you're 13 or 33 or 63. You're changing something fundamental in your body. So that raised a lot of questions for me too. And I'm putting this all out here. I'm sort of free thinking in this introduction because I'm trying to sort of formulate my own thoughts about how far this particular subject can go and what effect it will have, if any, on the people listening to the show. How can we spread the word, sort of? How can we, be proponents of this educational information that is flying under the radar? And let's look at something else I think is very important right now. If your doctor has misdiagnosed your loved one and he's treating her or him for dementia or Alzheimer's, he is making a lot of money. Plus, he's using a medical model that he has been trained in and swears by and has taken his oath in. How likely do you think that physician is going to be open to shifting his model and applying a substance abuse research and application and testing on his patients. So think about it. How often? In my thinking, not often at all, if at all. So how do we turn around some of this? How do we start people to think? There's so much at stake. I personally don't feel able and maybe not even willing to take on the AMA. But the truth is, I was training physicians and surgeons at Cook County Hospital 20 years ago. They all had their MDs, and guess what? The education they got in school back then was about a half a day, an education on alcoholism. Now, I'm telling you this because I trained them in Cook County Hospital, the largest teaching hospital in the world. And if they didn't know anything about alcoholism, what makes you think anybody else did? Meanwhile, the irony is, I'm working in the GI wards. And about 98% of the patients in the GI wards 51 and 52, total of 300 beds, were there for alcohol-related illness, mainly pancreatitis. Now, as an aside, the malnourished people, the minority people that aren't well-nourished, they get pancreatitis. The well-nourished white person gets cirrhosis of the liver. Both chronic, damaging, and fatal, but both come from affected by nutrition. So there's a lot of things to think about here. So at Cook, here I am, the only game in town. And I was, thank God, blessed by the head of surgery, who was incredibly influential and powerful, Dr. Olga Jonason. Rest in peace, Olga. And got sick of all the alcoholism. Now, Cook didn't even have a detox ward. So it's ironic, the recidivist rate for the alcoholic patient was about 97%. They had no alcoholic treatment providers on staff. Excuse me, and they didn't even have detox. So while you're thinking on that, I'm going to take a break and clear my throat, okay? Okay, I'm back. Thank you for your patience. Okay, we're going to jump right into it. When Jim sent me his checklist on topics he wished to discuss, the first 4 jumped out at me right away. I'm going to read them to you. First of all, alcohol abuse is the most readily recognized addiction in seniors. But is it addressed? It might be recognized, but is it treated? Alcohol abuse in seniors is very frequently followed after many years, even decades, of chronic on and off over drinking, which could be relapse, addiction relapse. But if it's not, it's the senior who has drank just about every day as a social amenity, the cocktail after work, the beers at the, alcohol plays a huge part in our social life. So it doesn't have to be necessarily relapse addiction related as much as chronic. Now, I'm going to talk about cellular adaptation at this point because cellular adaptation is the phenomena where you present enough of anything in your system and your system begins to adapt to it. And once your system adapts to it, then you have withdrawal phenomena if you take it away. So if you think about alcoholism and withdrawal, what you're really looking at is cellular adaptation. So the social aspects of, drinking all the time. I mean, I know people that drink every single day. I know if they're not in the early stages of alcoholism, there certainly will be. So the cumulative effects of years of over drinking, whether you're relapsing or not, whether you're diagnosed alcoholic or not, whether you're an abuser or an alcoholic or not, it doesn't matter. You really have to understand that. Over time, you're going to become an alcoholic. You're going to become dependent on the presence of alcohol in your system because your system would have adapted to its presence. So, the burning bush question that Jim and I talked about is, hey, has doctor, physician treating your loved one or you ever done an evaluation on substance abuse? If you sat down and discussed your drinking history with this person, and even if you had, does he know what it means? Can he put that puzzle piece in place? Most doctors aren't trained to do that. They're not. They're simply not. And that's a fact. That's a fact today as I speak. So, I took it upon myself to talk about the 4 cumulative effects. And what are they? Well, there's 4 major organs affected. And I did a Google search and bang, they popped up like pages. So this is not some hidden mystery. This is knowledge and information for everybody. They popped up, a lot of them, through treatment facilities. They want you to come, but there's plenty of other research outside of that. So here we go. We're going to look at this. The lungs, the heart, and the kidneys are all needed in order to live. Having these parts of your body healthy and functioning is important if you want to lead a good life. The effects of alcohol on the lungs, heart, and kidneys can put your life in grave danger. The more you know about the effects, the more you can take a good look at your alcohol use and misuse. The better chances you may have of telling yourself, hey, I need to get an evaluation. I need to look at this. I need a better understanding. You can go and do your own research. So what happens when the system, the cellular adaptation of alcohol in your system affects these major organs? Well, first of all, the lungs, and it's more severe because your lungs can collapse. More importantly, you can get pneumonia regularly. The pulmonary system, here's a sentence. The pulmonary system uses proteins and needs proteins for the lungs to function properly. One of the symptoms of alcoholism is sorry, I had to read something. I was trying to pronounce it, and I don't need to pronounce it. One of the symptoms is, a form of malnutrition. It's got a fancy clinical name, but if you're a heavy drinker, you are malnourished. Because, once again, the system is busy fighting a poison, not busy supplying nutrients to your major organs. It's in a constant battle because the cells don't know what to do. Because one day they're fine, you're not drinking, the next day they're fighting for their life, literally. This all happens inside your body. The heart is very much affected by alcohol. High blood pressure, heart failure. If you're a binge drinker, you have a much higher chance of irregular heartbeats, fibrillation. The heart and soul of your body. The kidneys. When you consume alcohol, your kidneys are not able to filter unhealthy stuff out properly. This is mostly due to the fact that alcohol use ruins the water and the ions that are supposed to help the kidneys do the filtration. In addition, alcohol is also the main cause of enlarged kidneys, which could lead to kidney disease and kidney failure. This could be deadly. So these are just 3 of the big red flags. Cellular adaptation permits survival and the maintenance of cell function. It may alter differentiation of genes, enabling a cell to change its form. Normal and abnormal cellular changes can and do occur. Atrophy. That's a decrease in cell size due to a decreased workload or adverse environmental conditions. It's adaptable and reversible. It affects atrophy of the kidney, heart, and lack of blood flow. All of this is going on while you're drinking. You can lose electrolytes, which can cause problems in your heart. Do you have a drinking problem? I don't know. But I know if you've had 1 or more blackouts, you do. That's a very, very early sign of alcoholism. If you start lying about your drinking, you got a drinking problem. If you start self-medicating, you've got a drinking problem. If you're unable to quit, you have a drinking problem. Now I'm going to talk briefly about Marty Mann, and then I'm going to turn the show over to Dr. Jim, who's patiently waiting, and I appreciate that. Who is Marty Mann? Marty Mann was the first woman to go to AA and become sober and write about it. She was one of the top 3, but she's the only one who wrote about it. She created the Marty Mann sobriety test. I'm going to give it to you today. It's very, very simple. If you fail it, you are an alcoholic. It's that simple, and you'll know immediately. All you have to do is write down today's date, which is the 16th, I believe. 14th? It's the 14th, isn't it?
Friday the 13th.
Yeah, but this show is on tomorrow.
14th, yeah, sorry.
We're having a little aside about the date. So I'm off in La La Land, as you can imagine. This is the 14th. Get a pencil out and write the date down. And then write 2 weeks from today, which is probably be the 28th, right? Decide not to drink for 2 weeks. Just write down, I'm not going to drink for 2 weeks. If you do, you fail the sobriety test. If you drank because it's a wedding, you fail the sobriety test. If you drank because it's somebody's birthday that you may not even hardly know, you fail the sobriety test. If you drank because you conned yourself into thinking you deserve a drink in 2 weeks, you fail the sobriety test. Non-alcoholics should not be concerned with not drinking for 2 weeks. It's a simple test. It doesn't cost a dime. If you white-knuckle it through 2 weeks, if all you think about is drinking for 2 weeks but don't drink, you're an alcoholic. It's a very simple test. Now there's much more sophisticated ones. So, it's time to take care of your body. It's time to think about the seniors in your life and who's actually treating them and what is really wrong with them. So I've laid the groundwork. We're going to shift gears. I want to introduce Dr. James Lewis, who's become a colleague and an important person in my professional life, and I'm very happy that he's here, and I appreciate his wife Barbara introducing us because we are so much on the same page. Hi, Jim. Glad you're here.
Thanks a lot, Velva. It's been great doing these series with you. So, Velva's been talking about alcoholism, alcohol abuse. There's some fancy terms that the field's come up with that are a little more palatable, sometimes called alcohol use disorders for people who don't want to say, well, I'm an alcoholic. And as she said a few moments ago, alcohol abuse is probably the most readily recognized addiction in seniors, but as we'll see as we go through the show, there can be many other less obvious substance abuse and chemical dependency problems. One of the big red flags for family members or the patient's physician is a history of falls and head injuries, especially when the older senior alcohol abuser denies over drinking. There's difficulties with stumbling, falling, motor vehicle accidents, that sort of thing. Interestingly, I came from a training model in the 1970s and 80s in the veterans hospitals in Washington, D.C. and Miami in the mid-70s especially. And the doctors there were calling this alcoholic organic brain syndrome. And now it's called alcohol related dementia. Why did the term change? And it is because the neurons in the brain, the cell bodies that basically run the brain and the central nervous system, start to deteriorate just like in many of the dementias. And the thing to realize is when we talk about like strokes, Alzheimer's, other forms of dementias, things like that, these are not either or phenomenon. They can be in addition to alcohol and substance abuse. Velva and I were talking after the show last week and preparing for today. She brought up the idea of senior drug swapping, that literally seniors are already taking on their own more over-the-counter and prescription medications. And why is that? I think of my very bright and witty brother Bill, who said, we begin to have more parts going out of warranty. And we start seeing doctors more often, and we're taking over-the-counter medicines and more prescription medicines. The difficulty is that the very people, think about this, younger and middle-aged people who are already overusing or abusing alcohol, but also maybe using narcotic painkillers and doing what is lovingly called recreational substance abuse, meaning amphetamine, cocaine, those types of things. So these younger and middle-aged opiate, amphetamine, cocaine, alcohol abusers age and become senior substance abusers. But people don't stop and think about grandma and grandpa at 50, 60, 70, 80 years old being like 20-year-old college students that are messing with these drugs. It's no good for any age, but what happens with the senior is that, and Velva really nailed it when she pointed it out, there might be like one or two little check boxes when you go to your primary care or any specialist doctor where you're supposed to check off any alcohol use, yes or no. But uncommonly, not often, is there any kind of a detailed discussion with the physician. Sometimes the doctors are great about getting it out of the person, sometimes not. So one of the very first things that's crucial is if the person, the patient, the adult senior that is overusing alcohol or substances is not reporting it, there needs to be a family member who is willing to be very open and clear about the senior's alcohol history.
Jim, I just want to, and
sure.
I agree wholeheartedly,
Yeah.
but a lot of people don't live with each other anymore. Mm-hmm. I mean, my kids are all in Chicago, I'm here in Florida. Families are scattered now. What if there's no way of knowing? Is there a medical, can a doctor investigate alcohol use covertly? Is there early symptomatology that is a medical red flag?
Well, like a lot of the things that you said, you start seeing damage to liver, lungs, heart, kidneys, and brain. But because so many other things can cause that, if it's not reported, it can take a while before things show up in blood work that trigger medical doctors' antenna going up and saying, maybe this person is using alcohol or substances. One of the key things, and like she said, there maybe the family members are out of town, might be worth the trip for the adult son or daughter to go to the home where the adult is living and attend. I work part-time at Central Neurology of St. Petersburg, and I frequently have a family member who's come from out of town that will attend a visit that I've just done a complex neuropsychological assessment on an adult who is thought to have some form of dementia or neurodegenerative disorder, who also turns out to be overusing alcohol or substances. Something to be aware of with seniors. We talked a minute ago.
So, in other words, you routinely do an evaluation.
I do evaluations, and I invite. I sit there with the person. It takes a couple hours to go through testing, and then I'm willing to give feedback when I'm finished. And I ask the adult patient, please invite a loved one, a partner, a living partner, spouse, adult son or daughter, come to the visit with you, where either I or the neurologist can go over our findings with a loved one. Now, part of the reason for that isn't to be sneaky, to get out of the loved one what's the real truth about your mom or dad or husband or wife's alcohol or substance abuse. One of the things that alcohol does, it damages memory, and dementia damages memory. So I want somebody there because, think about it, I've just evaluated somebody that I know has maybe an alcohol or other related memory disorder, neurologically based memory disorder, and I'm giving them a whole bunch of information. They're going to forget it when they walk out the door. So it's good to have a family member there just to hear the feedback. So when
that's a very good point. Mom
or dad, or you get down to the parking lot and say, "What did he say?" So, but it's an opportunity to get information out. But this stuff is deadly serious, and I want to get into that a little bit. I'm not trying to scare anybody, but it's better to be safe than sorry. So when we think about what is alcohol really, and the amounts that I'm going to tell you can be astonishing. It was a little not totally shocking to me, but it used to be thought of, oh, the alcoholic is somebody who's drinking a half a fifth of hard liquor 4 or 5 days a week. Well, that's true, but now we realize that there can be brain effects and other major organ effects to the following. More than 1 or 2 glasses of wine or beer and less of hard liquor multiple times per week can cause central nervous system depression. And
well, that's everybody. That's your social drinker.
Social drinkers doing 2 glasses of wine or beer 5 or 6 times a week. So three ounces of Chianti at night for dinner a few times a week. That's not what we're talking about. We're talking about chronic, what used to be called moderate drinking, but it's the cumulative effects that become dangerous. And if you think about what happens, so the person stumbles and falls and hits their head. Now you've got concussion on top of it. But this is the other really more dangerous thing. And I was kidding but not kidding about my brother saying we have parts going out of warranty. So person develops, knee problems, gets put on a medication for that, develops some other kind of problem, gets put on a medication for that, all legally prescribed medications. Doctors know that medications interact with one another. Alcohol can interact with these different drugs. Even in the case of a dementia, say a dementia that is not produced by alcoholism, and we know that I just said that can happen, alcohol-related dementia. Say the person is developing the early stages of mild cognitive impairment or mild dementia, and they're put on one of the 2 most common medicines that's used in the early stages of dementia. Those are Aricept, and that's the brand name, but now it's out in different generic forms, and a drug called Namenda, Namenda. Guess what? Alcohol can either interfere with those medicines being effective, or it can interact with them.
It can enhance their effect.
Enhance their effect or make the effect, and it can interact with, say, a person's taking Paxil or Wellbutrin or some antidepressant. Maybe he's done that for years, and drinking 2 or more drinks 4 or 5 days a week. You're taking an antidepressant, you're using alcohol, which the person's not thinking. Alcohol is a depressant, so I'm undermining the effects of these other medicines that I'm using. And Velva mentioned this idea of doctor shopping, and you have, and that isn't just seniors, but people of different ages. They go to one doctor for one thing, another doctor for another thing, and maybe intentionally don't want any of the doctors to know what all the others are prescribing. That is what can be deadly. Very serious dangers in that. And because they don't know even the legally prescribed medicines, if one doctor doesn't know the person's entire medicine profile, on top of that, then the person's, drinking, going to a party with a friend and a bridge party or whatever, say, hey, I get a little anxious and I use Xanax. Why don't you try a couple of mine? Well, that's an anti-anxiety agent. That's a central nervous system depressant.
Let's throw a pot in here for a minute because it's getting legal, and a lot of people. My first fear whenever I hear about pot going legal is drivers. My very first fear is about being on the road with people that are stoned because of the delayed reaction time, those kinds of things. But when you mix in, now it's legal, right? Mm-hmm. You can have your Paxil and your drinks and your whatever else, and you can still light up a joint, right?
Absolutely. You think, what is marijuana? What is cannabis really? It's a hallucinogen. It's chemically classified as a mild hallucinogen. But because of the legalization, there are now so many different strains, and you can go, in the states where it's legal for recreational marijuana use and say, I want one that's going to help me have some get up and go. I want one that's going to mellow me out, which is going to be more of an anti-anxiety effect. I want to, have more get up and go, more of a stimulant effect. And so, just using that substance, there's not enough research out yet about what does long-term marijuana use all by itself do. But what Velva and I are discussing is not people just using marijuana and nothing else. We're talking about the seniors who are on more prescription medications, more over-the-counter medications, who are also drinking, also using these other drugs. Now you've got 5, 6, 8, 10 different chemicals that absolutely interact with the central nervous system and brain.
And meanwhile, they're all passing joints at a party.
There you go. And somebody's the designated driver. So, but since we're talking about seniors, the idea here is that at any age, alcohol or multiple substance abuse, which is called polydrug abuse, can be extremely dangerous. But in seniors, it is underestimated. It is simply underestimated, primarily because this stereotype that we think of, Johnny Jr. in college, having beer bashes and getting stoned every other night. That's 18 or 20 or 22 years old on spring break. And they're not thinking that 60 or 70 or 80-year-old grandma or grandpa is doing something fairly similar on top of taking tons of other medicines that their doctors are prescribing. So this can just be a significant issue.
I just want to read the one thing that came up on my wall. Here's a woman who said, my sister is almost 78 and continues to doctor shop. She claims every ailment in the book, takes antidepressants, anxiety pills, pain pills, sleeping pills, and a heart medication. It's a miracle she's still alive. She probably sees 4 doctors a week, has been to the emergency room 6 times since January, but still finds a way to travel to Europe, the Caribbean, over to the casinos to gamble. My question is, how can doctors allow this? Well, I think Jim has answered that by saying this woman has different prescriptions from a variety of doctors, and they don't know about each other. Yeah,
and the thing about it is, Velva's describing this person who wrote into us who has a mom or a friend that's in their late 70s. Sounds like they're having a good old time. It is going to catch up. There is no way to. You can fool your doctor, you can fool your friends, but you can't fool your own internal organs. The brain is not fooled. Alcohol has the same potential neurotoxic effect on the brain, no matter what age you are. But it's because it is so cumulative. After 5, 10, 15, 20, 30, 40 years of steady drinking, abusing substances, the cumulative effects start to present. And that's where you start to have the patient who is presenting with symptoms that are mimicking Alzheimer's dementia. It doesn't mean they don't have Alzheimer's dementia, but it can be both.
I think that's vital I'd like you to repeat that, because I really think that's absolutely vital. Just say it again, would you?
Yeah, the cumulative effects of alcohol and substance abuse can take decades to start building up and producing symptoms. But when they cross this threshold and start producing cognitive and memory symptoms, sometimes motor symptoms that are going to set off maybe a Parkinson type reaction. But nevertheless, when they start presenting, they come across as the same symptoms that you see with the early stages of Alzheimer's dementia. And again, these are not either or. The person can be getting an Alzheimer's or Parkinson's disease in addition to having alcohol or substance abuse. And think about the patient and the family, either wittingly or very wittingly, are hiding this embarrassing history from the doctor, who is then going to prescribe yet more medications that are going to be interacting, often in a very negative way, in a bad way, with these alcohol and other substances that the person is using. So,
another thing I just learned too, I want to throw in about the doctors, because most of them honestly are clueless unless they've taken the proper training. There are doctors now that are trained in addictionology. It's at a medical training now. The average doctor is not. And so they say things like this to the patient because they're trying to be like friendly, or they're actually, I don't know why they say dumb things like this. They say things like, well, you shouldn't drink so much. They soft pedal. They don't do an intervention. They don't take the responsibility. And I think that's libel, personally. They don't take the responsibility and say, we need to really evaluate you. I'm going to send you to an expert for an evaluation. They don't do that. They just say, you better not drink so much, or try to cut down on your drinking, Jim or Bob or Sue, whoever it is. And that's actually a death sentence. And they don't even know it. A conscientious, thorough physician will say, we need a closer look at your drinking. I don't have that kind of tools. I will send you to somebody. And that's the responsible thing to do. That's my 2 cents.
I'm very fortunate at Central Neurology to be working with some very astute neurologists who don't miss this kind of stuff. But when I'm looking in the medical records of the patient who's finally referred to us, and I see they've seen 2, 3, 5, 8, 10 doctors, sometimes neurologists, but psychiatrists, numerous doctors who have not picked up on doing a really thorough alcohol and substance abuse investigation with the person. I want to mention something that also doesn't just jump out at people. Velva mentioned that I work with Pinellas County. So I work part-time at Central Neurology, where I have an adult neuropsychology practice. But I work at the Suncoast Center, where I'm part of Florida Children's Medical Services, where we're seeing abused and neglected children. So what's not jumping out? You're thinking, what's that got to do? What does seeing abused or neglected children have to do with grandma or grandpa having alcohol or substance abuse? Well, here's what it has to do with it. Almost every state has a rule that if a child is being abused by a biological mom and dad, before the child is placed into foster care, the child welfare system has a legal responsibility to explore if there is another, in quotes, safe or appropriate family member. So who's the most likely family member to look for when the child shows up abused or neglected? The grandparents. Lots of incredible, wonderful, even saintly grandparents around. What ends up happening with me is, so I'm seeing the child, they're placed with grandma or grandpa, and I come to find out the child's witnessing grandma and grandpa getting drunk, fighting, stoned. Child walks out the door, no one's watching them in the neighborhood, and I end up seeing the senior citizen through the child welfare system. I never would have imagined that on my own until it started happening, that I was actually seeing it. And end up presenting information like this to the dependency court, child abuse court judges who really want to become aware of things like this. So it's just something that is pervasive in our culture. And in a minute or so, we're going to get into something. We've identified what are these problems. Velva's made some great points about not just recognizing, but doing something about it. So once the family or the patient is not in denial anymore, then what?
Okay, we're going to take just a 10-second break and get back with that vital information. Don't go away. Okay, we're back. We just needed a breather, and I think you might have needed a breather too. So thanks for sticking it out with us, because this is big, this is heavy, this is content rich, this is going to be shocking news to people. I'm hoping those who are listening take another, and our caretakers of a senior, take another good look. And I'll tell you one thing you can look at, which will be a clue. There's clues everywhere. Is there a history of alcoholism in your family system? Alcoholism is got there's a precondition for a lot of addictions. There's a vulnerability if you're from a family of alcoholics and an alcoholic system. So, if you look back and you knew there was, and often in the old days, the person was put in an attic or they were called crazy or something like that, but there was a lot of hidden it. I had a client that had to go to Ireland to actually learn the family history and how pervasive alcoholism was in her family system. And nobody knew it. So, but there are ways of finding out. Anyway, Jim has got some great insight for you right now.
So what do we do at the point where the person recognizes either the actual affected patient or the family member is saying, okay, there's either alcohol abuse in my family, some kind of recreational drug abuse, some kind of prescription drug abuse, or some combination of those three. What are some immediate steps? Velva and I didn't want to just dump all these problems on the audience, say, oh, here's all these terrible things that are happening, and leave you with nothing to do about it. So what is the absolute first step? Absolute first step. Immediately consult with a trusted physician and report every single prescription medicine, every single over-the-counter medicine, every single recreational drug that the person is using now, and I like to say used over the past 10 years. Why is that so important? Because how can a doctor, and Velva talked about, some doctors are not enlightened, others are. Let's say we have an enlightened physician here who really wants to help. If there's secrets, if you don't give the full history, all alcohol use, how much, how often, all substance abuse, all prescription drug abuse, all of it on the table, must do that. That's an absolute necessary first step. What's the second point? It can be incredibly dangerous to just cold turkey. So the person says, well, oh my God, I've been doing all this drinking and drugging and all this. I need to stop. It can be quite risky medically to suddenly stop, terminate alcohol or substance abuse. Velva mentioned the idea of withdrawal issues. There can be seizures, there's fatalities, there's lots of problems that can happen. So once consulting a physician that you trust, that you can talk to, and given the entire history, do not just suddenly stop everything on your own. It's under medical supervision. Some doctors might say, we can't do this as an outpatient. You need to go to an inpatient detoxification program, particularly for alcohol, but I would say true too for certain of the prescription substance abuse, especially the rampant prescription narcotic painkiller abuse in our culture. And that just doesn't go for young people. There's lots of elderly people who have aches and pains and joint disease and arthritic changes and things like that are on prescription narcotics that develop opioid dependency that is equally as dangerous as alcohol abuse. So we have the first two steps. Go to a doctor, tell everything, let it all out, no secrets, and don't cold turkey.
I want to mention something here. I think it's important for the listening audience to understand this fully. I'm not 100% sure, but I think that you can report all your alcohol and drug use confidentially. And here's what I'm saying. Here's where I'm going with this. I've had clients, and one of the reasons I had such a large practice was because I wasn't affiliated with the hospital. I had a standalone private practice, and people felt safer. I never kept clinical notes. I kept what they call, my personal notes, which weren't nobody was called into court with them. I didn't have to reveal those anywhere. So I think that I want you to talk to your doctor and say, hey, listen, I've got some stuff I want to tell you, but I don't want it on the record. And if he's smart, and if he's committed to helping you, he will agree. And that means that you can pour your honest drug and alcohol use out and not lose your insurance, not lose your job, not get into deep doo-doo because you've been honest. And I think that's really, really important. If your doctor won't give you that insurance, find another doctor. Because you really need that assurance so you don't lose your job or your insurance. Because honesty can sometimes, come back and bite you in the butt. But by all means do it, because on the other hand, you don't want to die either. And, you need to start questioning every pill you put in your mouth, every drink you take. I know I'm on another rant. I feel like I've been ranting during the whole show. But I just wanted to say that because I flashed back to some of my clients who said, I'm so glad I can tell you everything because you're not going to report me. Well, I'm not there to report anybody. I'm there to help them. And so is a good doctor. Okay?
So we're going through these steps. And the first two that I mentioned about going to a trusted physician and making sure they understand everything that you're taking, and then working with the doctor to start going through withdrawal, not doing cold turkey withdrawal. That deals with just the physiologic issues involved in alcohol and substance abuse in seniors. What about the psychological part? Well, then what are the next two things that anyone can do? First is, and these are just so widespread in our community, go to any of the 12-step programs. Alcoholic Anonymous, AA, NA, Codependence Anonymous. Any of these 12-step programs are recovery programs that help the person get quit and stay quit. But first the medical supervision, and then looking for a 12-step program. We know there's something now. For many years it used to be called dual diagnosis. Now it's called co-occurring disorder. It's very common that a person, and we're talking about seniors here, but it can really be any age, that's abusing alcohol, prescription drug abuse, recreational substance abuse, can also have some kind of mental disorder. And I'm using that term loosely. It can be depression, anxiety, whatever. So going to the physician, reporting everything, having physicians supervise withdrawal, going to one of the support group programs, those people, still there are a percentage that are going to need to consult with a mental health therapist. We've discussed the idea of seeking out mental health counseling in some of the earlier episodes that we did in this show. And Velva and I pointed out, this is not the generic therapist in the community. When the person who has had alcohol or substance abuse goes to consult with a mental health professional, they want to make sure that the mental health professional has had experience dealing with not just the reported symptom, I'm depressed or I have anxiety, but they've also had experience working with people who are trying to stop alcohol and substance abuse disorders. So finding the right therapist, and it can be as easy as You get the list of mental health therapists that are in your health insurance provider network, so you're not paying all of it out of pocket. It can be going to the county health department, whatever. But you ask the person, maybe even at the point of setting up the first visit, do you have experience working with both the mental symptoms I'm having, anxiety, depression, whatever, and alcohol and substance abuse? If they say no, you move on, because treating one of those and not the other doesn't work. So treating just the anxiety or depression, but not treating the alcohol or substance abuse, make both worse. Treating the alcohol or substance abuse, but not treating anxiety, depression, or the other mental health issue can make both of them worse. That's why it's called co-occurring disorder, treating both of them at the same time.
And another way you can determine, there's a lot of good therapists out there. There's a lot of well-meaning, dedicated therapists out there. What there aren't a lot of is people that have been clinically trained. And there's a huge difference between a counselor and a therapist, and a coach and a clinically trained therapist, and somebody who can actually cut through the BS and take a clinical look at your presenting problems, that knows how to do a diagnosis, that understands and connects the dots with certain behaviors. Everybody's well-meaning, but, not everybody's going to save your life. And a lot of this is life-saving stuff. When we get to the point where you have so much damage to your body that you're one step away from, a tragedy, either, a natural death or an unnatural death, then, you've got to really make sure that you're getting the proper care. And to the counselors out there, I say, if you don't have these skills and these diagnostic skills, then you've got a responsibility, just like the doctor does, to refer the patient. You're out just for an assessment. You're not going to lose the patient. Back in Chicago, I had many clients that came to me for 1 or 2 sessions for an evaluation for something. They went right back to their therapist. This isn't about client stealing or anything like that. It's about getting the right information. So your therapist, the person committed to helping you, can help you make decisions. You can't make them if you don't have the right information. Then you're just guessing. So I want to put that out there because I think it's a lot of people, back in Chicago, everybody knew. I would say, listen, I'll see them maybe no more than twice. And trust me, they're going right back to you. And after a while, that was understood. But there's a lot of people that are very protective about their clients and their practice. And they feel like if they refer them out, somehow they're going to lose them. But let me tell you something. You can't lose a client that's committed to working with you. You can lose them by under-treating them, where they finally leave in disgust, or you can do it by saying, hey, I don't have that particular skill. I want to make sure I'm helping you the best I can. Go see Joe Schmo. Do you know what I mean? This is all common sense, and this is all ethics too. There's a responsibility here on an ethical level, and a professional level.
Yeah, this is such a great point. I'm reminded of a webinar I did for the Florida Licensed Mental Health Association, and there were many people in attendance. It was a live webinar, so they were calling in their questions, and I mentioned that I've seen patients of all ages, especially seniors, who I've said this to. You need to check the people's credentials out. What is their background? And some of the seniors have said, well, I don't want to offend the person on the phone and say, oh, well, you don't have the training that I need. The mental health professionals who attended this webinar I did, almost to a person, came back with the same thing. Somebody who was well-trained, who was ethical, they are not going to be offended by asking, is this one of the specialties in your practice? It's the people who are not well-trained, who you wouldn't want to go to in the first place.
No, but they're
offended.
They're out there in force. They're just calling themselves these fancy names. But, there's a way to find out who's got the training or not, other than just asking. You can do your own research on the person. Find out what school they went to. What was their specialty? I talked to a woman when I first came here, a very delightful person. She says, oh, I'm a therapist. I said, oh, great. Where did you go to school? Oh, well, I didn't go to school. I was originally a lawyer. And, they reinvent themselves and they take a couple of classes or an online course or some bullshit, pardon my language, and they label themselves a therapist. And, that's not the way it goes. But she's charming and attractive, and I'm sure she had a lot of clients. But that doesn't mean she helped anyone.
Yeah, there's so many ways that you can find a competent person. A lot of times your doctor may know a mental health therapist who can work on that part of it. The key point I was making, and then I'm pretty much finished my remarks for this episode, is that if you have alcohol or substance abuse and you have some other issue, depression, anxiety, some other mental health problem, going to the physician is a key step. Getting the support group, AA, NA, Codependence Anonymous is another important component. And going to an appropriate, competent mental health professional. That will increase the likelihood that the person is going to be able to stay abstinent and not have relapses. Relapses at 20 or 30 cannot be life-threatening, not necessarily. Relapses at 70 or 80, after the cumulative effects of alcohol and substance abuse for 30 or 40 years, can be not just short of deadly, clearly fatalities can occur, but short of that, significantly affect the quality of life for an older person. So seniors especially have to get the best possible coordinated treatment plan.
Good. Thank you, Jim, so very, very much, because you bring so much to this topic. I'm constantly impressed. I want to close the show with something else I think is important. I think if you educate yourself, you're sitting here, you've listened to the show, and you're starting to wonder. My advice is don't do anything except start learning. Just go online and start doing some research. Go to legitimate medical sites that have research on this subject we're talking about. Start educating yourself. Because the more educated you become, the wiser your decisions will be. And that's really, really important. And, once you get educated and you have a better understanding, you've got this radio show, which I hope you listen to more than once, but also go online, check out this thing, check out that thing, check out where the local AA or NA, or there's a program. You can buy a book called The 12 Steps for Anybody. So if you don't say, well, I don't belong in any of theirs, well, just buy the book and start working the 12 steps, because they're good for you, because they help you. And just find these things. And the next time you have anxiety and you want to drink, go meditate. I mean, we're all knee-jerked. We're a pill nation. And that's part of your job now, is taking care of yourself, getting educated, and changing direction in your life. Because your life is valuable, and it's certainly worth living. And when you do that, you'll find your purpose too. And that's really important. So thank you for listening. We're going to do more on this subject. We just have to start getting organized about it. Thank you again for listening. Thank you, Joe, at UPS at 2nd and 2nd South, for making this possible. You're just wonderful, and I'm forever grateful. And thank you, Jim. I'm grateful that we've met. Thank you, Barbara, for introducing us. And I have a lot of gratitude today. So we're going to go off now. Here's my theme song again. I hope you love it like I do. Talk to you soon.
Let's talk about life. Let's have a little conversation. Let's talk about life. Maybe learn a little information. Let's talk about life. And let's talk about